Hi there, my name's Steph, or Dr Stephanie Slater. I am a GP trainee currently working in London, and I'm here today to chat a little bit about mental health. I myself have anxiety and depression, and I've had some really tough times, but I've learned loads. I've got so many good coping mechanisms now, and I'm really trying to reduce the stigma around mental health. I hope you enjoy this. Okay, can people with depression stop taking medication? So the answer is yes, they can. So I think that something that I've come across and something that I've personally experienced is people being really worried about saying, if I go on medication, won't I have to be on that forever? And that's not the case. So I would say that for me, I was really worried. I had so much internalized stigma about medication. I didn't want it. I thought it was weak to take medication. I thought that is just not for me. I can do it without. Fine, I'll go to therapy, but I'm not doing it. And once I'd managed to get rid of that internalized stigma and realize that actually taking medicine is just trying to help myself a bit more. It's really saying I care more about looking after me than I do about what all these other people think, which was so great, and I'm so glad to get to that point. The things about stopping medication, so I was on antidepressants and I have now stopped them, but it was so important for me to wean that down really slowly. If you suddenly stop taking an antidepressant medication, you can get lots of symptoms that are quite nasty and you can feel quite unwell. And so it's really important to check in with your either psychiatrist or GP before suddenly stopping something. It's good to wean it down really slowly, and that might involve reducing the dose for a couple of weeks and then reducing it down again. But yes, you can come off them. Okay, can people with depression, okay, maybe I'm going this side. Can people with depression have anxiety too? So yes, I have a diagnosis of depression and anxiety, or what we might code it as mixed anxiety and depression. So I think that it's a really interesting one. What I find is that people who are suffering with lots of worrying or lots of anxiety, often that can really affect the mood, and it definitely did with me. If I'm worrying about things and overwhelmed all the time and really stressed, my mood tends to get a little bit lower, and so that would probably go into that category. With depression, sometimes people feel really unmotivated and they don't have lots of worrying, and that's just depression maybe by itself. And for me, really, it doesn't matter too much what category. Some people really like to have a diagnosis, and that can be almost validating, because if they've been struggling for a really long time, knowing what's going on can be so useful. Other people just want to do the management and don't really want to label things or don't really want to know about it. I don't even know for myself whether my GP has me coded as anxiety, depression, or both. And that's something that I'm leaving up to them. Okay. Can people with depression laugh? Yes, yes they can. So I think it's such a shame that people stereotype people with having depression as people who are sad all the time. I just don't think that's the case. And you can use me as an example. I try to say that really everyone's an individual, and everyone will have there'll be people who are maybe a bit more negative, people who are a bit more positive, and that's all okay. We're all individuals, we're all different people. But yes, they can laugh. When I was really, really low, and when I was at my lowest and not wanting to be here anymore, I couldn't laugh. I couldn't even imagine laughing. I was stuck feeling low. I felt that nothing was going to get better. I felt everything was hopeless. But I've been so lucky to get the support, and I'm proud of myself as well for reaching out for the support, because it took me such a long time and I ignored my mental health for so long. And now I look back and I think, I also think it's so silly, because I think that people who are able to get help for their mental health and are brave enough to do that, I think that's really inspiring. Okay, can people with depression get therapy? My favourite subject. Yes, yes, so we definitely can. So I think I love therapy, in case you couldn't tell. So I think therapy is so important. For me, what therapy did was it taught me coping mechanisms, and it taught me a bit about why I think the way I think, but also, okay, maybe I don't know the reason why I'm feeling really sad or really anxious, but how can I work through that? And it really empowered me to be able to say, okay, I'm feeling low, I'm feeling anxious, but I can do something about that. And for me, that was such a great thing to learn. People with depression, speak to your GP if you can, or a loved one. There's lots of different ways of accessing therapy. I would say that I'm really hopeful that things are going to improve and that the wait times are going to reduce, because I think therapy is so important, and I would prescribe it for everyone if I could. Okay, is anxiety a disability? So I think this is a really interesting question. I think that why it's so important is that for a long time we've only seen physical illnesses as disabilities, and that's not fair. I don't know if fair is the right word, but I was at a point for myself when I was significantly overwhelmed, crying every day at work, and really struggling with my anxiety, and I couldn't function how I would have wanted to function. That being said, personally, I don't necessarily identify that I have a disability, but I think it's just really an individual thing. I think that, yes, it can be, mental health can be a disability, and it really depends on that individual, what they're going through, what they're facing, and where they're at. Is anxiety a chemical imbalance? So this is an interesting one. So I think that there's been loads of different research on this, and the things that I know about this personally are obviously that when we give antidepressants, they are to help with the serotonin levels and different chemicals that are in the brain. What I would say for me personally is that I think that anxiety can be influenced by loads of things. I don't think it's just a chemical imbalance. So many things can affect us and affect our mental health. And so, yes, I would say a little bit, but I don't think it's the only thing that it is. Is anxiety easy to spot? So that's an interesting one. I would say overall no. I think that I'll give my personal account and then I'll give some other thoughts that I have on it. So for me, if people find out that I have anxiety and depression, and quite a lot of people I know do now because I talk about my story on social media, just trying to help get rid of the stigma. So when people find out, a lot of people who've not known me for a while are actually quite shocked. And they're like, what? But you like laughing and happy all the time. And I'm like, no, that's not what anxiety is. Quite a lot of people are good at hiding things. And that's not necessarily that they maybe want to hide it, but maybe it's that they feel they have to hide it to carry on with their day and get through things. I think that there are some people who when I'm speaking to as I'm the doctor and they're my patient, sometimes I'm able to say, oh, you sound like there's a lot going on. You know, how are you feeling? Do you find you've got more worries? Do you find you're finding things more stressful? And so sometimes for me, yes, I can spot it, but I would say that it's not always easy, and we can't always say that just because someone looks happy that they're not struggling inside. And by talking about all these things, my hope is that we can get rid of all this stigma to the point where people feel they're able to talk about things, whether that's with a loved one, a GP, anyone that they feel comfortable with, and hopefully get support, because everyone is deserving of support. And I think when I've been really unwell, I haven't felt like that. I've felt like I'm not worthy and I'm just causing havoc on other people's lives, and that I'm a negative thing and that I could never make anyone else happy, let alone myself. But it's just not true. And I know it can be really difficult to come out of those places, and I hope that anyone who is there is able to reach out and access support. Okay, is anxiety curable? So I think this is a really interesting question. I think that the simple answer might be yes, so to whether it's curable. And I think that for me, when I think about anxiety as a doctor and as an individual, I think that there's lots of different parts to it. So you could say, oh, we're going to cure it by giving you a medicine. And yes, that might help somewhat. But also talking therapies, coping mechanisms, learning about self-care, all these things can be so useful to help us. I feel for me that I probably won't ever say I'm cured from anxiety, and that's just because I know that for me, my journey is more like this. I have days when I'm feeling really good, and I have days when I'm feeling quite worried and as if I can't cope with things. Fortunately though, because I've been through therapies and I've been so lucky to get so much support from my loved ones and everything, I now feel able most times to tackle that and to say, okay, right, let's take a break, let's put on a non-COVID face mask, or let's watch my favourite TV show, or let's go do some exercise. And I've got those options of ways of managing it. So I think that I'm open to anyone who says that they're cured from it. I think that is great. If that helps them and that goes with their journey, then yes. And yes, there are loads of things we can do. For me personally, I think it's going to be a journey like this, and I'm okay with that. And that makes me feel better, just because I know that if things go wrong again, I can tackle it. I'm not going to feel helpless. I know I've got things and ways to move through it. Cool. Thank you so much to Best For You for inviting me to here today to speak about mental health. I've had such a good time and I've loved answering all your questions. I really hope for anyone who is struggling that you know that you're worthy and deserving of support, and I really hope that you feel you can speak to someone if you've not done that yet. Either way, we're here for you, and I really hope that you can check out some of the Best For You information for more support. And I'm on Instagram as @Dr Stephanie Slater, in case you'd find that useful to have a look at my page. I hope you have a great day, and thank you so much for listening. Bye.